My name is Julie Egerbrat-Nord. I'm the event assistant for the South Dakota Parkinson Foundation. I have the honor of introducing our first speaker. We are very excited to welcome Joan Halas to our 2025 conference. Joan is the manager of Struthers Parkinson Center, a Parkinson Foundation Center of Excellence, where she has served for nearly 20 years as both a social worker and a leader. She is a dedicated advocate, educator, and mentor with the Parkinson's community. Joan has shared her expertise at conferences across the country and played a key role in national initiatives to improve care for those living with Parkinson's. We are honored to have her with us today.
Thank you. Okay, that's a tough act to follow, right? Stephanie's very deserving, though, again, stepping in quite at the last minute here. So, so they tasked me with talking about sleep first thing in the morning, which was not my first choice in time, but I think I was the last one to say what time I wanted. So, I will tell you, we know sleep concerns are part of it. If you nod off, I will not feel offended, okay? It's funny to have sleep be the first one because the people that probably need to hear this are probably the ones that are tired or they're running late because they didn't sleep very well. And all the early birds are probably not the ones that need to hear this, but we'll go ahead anyways. There's a reason I'm in the running late, don't sleep so great category, so I can relate to a lot of the concerns that people have. So that's actually where we'll start. I already said who I was. Why is this not working? There we go. Okay, so we're going to start with what are some of the common sleep concerns that people with Parkinson's will deal with. And I know there's a lot of spouses and family members in the crowd as well. And frankly, if your loved one is not sleeping well, it usually comes to play where you're not sleeping well either, especially if they're your bed partner. It can be very disruptive if someone is up and down and not doing very well at nighttime. So you're part of the journey is alongside them. We're also going to talk then, what can you do about it? So there's a reason I called it coping with strategies. I won't spend the whole time talking about the nuts and bolts of the medical stuff. What can you do for it in reality? Many of these tips and suggestions you've heard before, or they're fairly practical. And you, again, even if you're not the one living with Parkinson's, may find these helpful in your own journey of trying to get the best sleep you can. The last thing we'll talk about is the environment and other things that you can do to help improve your sleep. So, if you're up when the owls are, these are common things we see with Parkinson's. Insomnia, actually I'm going to go into all of these in a little bit more detail. So, insomnia is one, restless leg syndrome, very common, in fact, could be very early for those living with Parkinson's. REM behavior disorder, so that is where kind of dream enactment comes into play. They're doing some studies looking specifically at that, and that many folks dealing with that diagnosis will eventually develop Parkinson's disease. So is there a way to catch them sooner before it gets to full-blown Parkinson's? We know that vivid dreams, hallucinations, confusion, and then just an increase in Parkinson's symptoms can cause concerns with sleep. Okay, so if you look like this guy, right? Hopefully you don't. It's blipping, I don't know, but hopefully you can still read the screen. But essentially insomnia, or difficulty falling asleep and staying asleep. We'll do a little participation to get you moving a bit. How many of you would say that you deal more than 2 or 3 times a week of not being able to stay asleep? Anybody in here brave enough to raise their hand? Okay. I think there's enough hands. I think, again, it's a relatively common. Some people will, again, for falling asleep is the problem, but others will be up in the night and then not be able to fall back asleep. Different things we're going to look at. Sleep hygiene is a commonly used concern that, anyway, sleep hygiene is a commonly used term of really what can be done in your environment. We're going to spend a fair amount of time talking about that this morning. Cognitive behavioral therapy is another specific therapy treatment that people will undergo, and there's a specific one for insomnia that people can get tapped into. And then we know that there's medicines that can help. The medicines listed there, trazodone and mirabazepine, are both antidepressants that are commonly used to help people to go to sleep. They're actually can help with mood, but their major side effect is sleepiness. So they're often given at nighttime to help with sleep, and then the better effect probably is helping with the mood throughout the day. So I am not a doctor. These are just suggestions and commonly used strategies within our clinic that we have in Golden Valley near Minneapolis. We do know that doctors very much try to get people to stay away from some common strategies, things like Tylenol PM, Benadryl, or Ambien. These are often when people they don't know what else to do. They're tired of being awake at night. They'll go to these kind of over-the-counter options. However, long-term use of these is thought to cause major cognitive issues. And unfortunately, folks with Parkinson's, we know that there can be cognitive issues that come. About 80% will deal with some change in their cognition over time. So we won't want people making that worse by taking Benadryl every night to go to sleep. So if you find yourself kind of going for that Tylenol PM on a fairly regular basis, then you got to make sure you're finding other alternatives to help you sleep, okay? Another common one is restless leg syndrome. And this is, again, present in some folks prior to their Parkinson's being diagnosed, so prior to maybe that tremor starting or some other more classic symptom of Parkinson's. It's an achiness or a itchiness feeling in the legs where you just feel like you have to move them, okay? It can happen just in the evening, so some people will report just watching TV at nighttime. They can find that they just can't get their legs still. One of the easiest treatments is to get up and move around, and they'll find that the feeling will go away. Now, at 2 in the morning when you want to be sleeping, getting up and moving around is not really going to help you sleep, right? So, if it's quick enough and you can kind of just lull yourself back by moving around, getting the feeling to go away, then that might be what you need to do. But there's some other things. They look at one common medication that's given is gabapentin, which is essentially a nerve pain pill. If people have issues with other neuropathy and other pain from their nerves, gabapentin is kind of the gold standard that's given. So it definitely helps with restless leg syndrome. We also know that some of the dopamine medicines, so particularly the dopamine agonists, were originally designed for restless leg syndrome. So medicines like Mirapex and Requip. They come with some side effects, so you need to be careful with those, but certainly they can help with restless leg syndrome. And then we know, actually, antidepressants make it worse. So all of this is to say that it's complicated when it comes to medications for your sleep. So making sure you're talking with your doctor and you're not just telling your primary care you need these because the lady at the Parkinson's conference told you to take them. So making sure you're working with your Parkinson's neurologist, because understanding the combination of these drugs can be quite helpful. Another one is very common, and they're actually doing stuff. I've just heard about some updated on research that they're doing at the University of Minnesota on REM behavior disorder. So what this essentially is this is acting out your dreams. Anyone have a dog in the audience? Okay, not a lot of dog owners. I'm a huge dog owner. So anyone ever seen a dog when they're sleeping? When they're sleeping, they're actually acting out their dreams, and you'll see them they look like they're running, right? And so I guess cats do the same thing, but I'm not a cat owner, so cats, I guess, do the same thing. But what essentially it is when we get to that deep, deep sleep, the dream phase of our sleep, our the brain should shut down our body. So we're disconnected from it. However, if you have this disorder, REM sleep disorder, behavior disorder, your body's not shutting it down. So you're trying to act out your dreams. And there's lots of, evidence to show that most of it's with the hands, like pointing and shouting. Punching can happen. I've heard lots of stories about this, people popping out of bed or jumping out of bed, running to I've had people running into dressers. Just disastrous type behavior can happen if untreated. And so if you are at the point where you're already shouting things out and moving around a lot, it's something to monitor and make sure, again, you're bringing it up to the docs. Various treatments are out there looking at that. I should say, again, so the studies they're doing at the University of Minnesota are looking at early. Like there are people that that's the first thing they're dealing with is they're shouting out dreams even in their 30s and 40s. And then they've been following them to try to see what can come. And it's a fairly high percentage that will develop Parkinson's disease or some will develop Alzheimer's disease. And so if there's a way that we can catch these people early, is there some preventative type stuff we can look at to maybe before it gets to more of these chronic illnesses. So, but if this is something you're dealing with, again, often doctors will look towards melatonin. Clonazepam is another one that's actually used for seizure disorders, but also can help shut the body down. That's the main goal with that one, and it's commonly used. These are relatively old drugs that are fairly mild and are fairly well known, so not necessarily, they kind of know what the good and the bad of them. But we do know that actually levodopa, the main drug you all take for Parkinson's disease, can make this stuff worse. So a lot of times it's trying to find the balancing act of how much can we put up with. Some other things that can happen at nighttime that can be very disruptive are increases in confusion and hallucinations. I know these aren't people's most favorite topic when it comes to living with Parkinson's, but they're unfortunately a reality for some people. So common confusions that we can see are there's a term called sundowning, and you may have heard this term. It basically describes when the sun is going down, so kind of that evening time, they get disorientated and more confused. And so that can lead then into into nighttime and sleep time, and be quite problematic. And often, if it becomes more of an issue, like an ongoing, everyday type issue, this is when we start to see more and more caregiver strain. And as a social worker, my role for many, many, many years was working with caregivers and supporting them on their journey. And I will say, when confusion, hallucinations, this kind of stuff is going on at night, it's a key thing to make sure, do we need home care? Do we need to find a different housing alternative? So if we can catch this stuff early and try to treat it early and not just play it off like, oh, it was we had a bad night, trying to do something about it is much better than letting it go and it kind of blows up. So there are different treatments they use. Donepezil is a common memory drug. Probably it's one of the only ones on the market, really, that they've think can help with memory. So commonly used if confusion is popping up more. There are different medicines that can help with hallucinations. In fact, one of our vendors here is promoting that drug. You can check that out. We also know that levodopa can make some of this stuff worse. So sometimes it's about trying to pull back on carbidopa, levodopa at nighttime to reduce some of these strains and stresses. And then a lot of it's about behavioral adjustment and trying to work through better ways to handle these confusion, hallucination situations. Last one that I'll talk about that it comes up, there's two of them. Parkinson's symptoms can increase. A lot of people have told me that their tremor seems to be more engaged at nighttime and it's hitting the pillow. And boy, it's really hard to sleep if your pillow's kind of getting boom, boom, boom. And so a lot of folks will talk also about feeling more stiff or rigid and just can't get comfortable. So they will often look at, is there medicine, like long-acting medicine that could be used through the evening time to help people still get the relief of their symptoms through the nighttime. Others will look at, again, more environmental adjustments to help. I'm going to talk about changes in the sheets you use, the pajamas you use to help with that movement piece if you feel real stiff as a board. We also know that anxiety and depression are very, very real in Parkinson's. A big part of what I did as a social worker was talking with people about their mood and emotions. About 50% of people with Parkinson's will deal with some sort of mood change. So anxiety and depression being the most common. And I will say for a lot of folks, it flares up at nighttime. So we're going to talk about some of those strategies you can use to help relieve if all of a sudden all those anxious feelings are hitting you at 2 in the morning, okay? And then there's the bladder, right? I'm getting older. I got my cheaters, got my official things, and I know that nighttime, if I don't cut myself off, or certain things will seem to trigger the bladder and I'll have to go to the bathroom in the middle of the night, okay? And so I think it becomes more normal as the older you get. The hope is, though, that once you get back from the bathroom, then you can fall back asleep. And that's the challenge. We recognize that you should probably you will have awake times at night. It's just a natural part of the way our rhythms go up and down, okay? The challenge is, once you hit that awake time, can you just adjust and then fall back asleep? And that's, if we're at the problem where you can't do that anymore, that's when all this stuff that I'm talking about is needed and needs to come into play. We also know there's a fairly recent study, just like 2 months ago, came out on sleep apnea, which we know is very, very common across the U.S. It's huge in my family. Most of my dad, my brothers all have sleep apnea, so I paid a little more attention to this one. They actually found untreated sleep apnea. So I know those CPAPs suck, right? At least that's what I hear. But untreated sleep apnea, they did a 5-year study looking at it. 18% of people develop Parkinson's disease. Yikes, right? So if you're sitting in the room, you're a family member, and you're like, well, I get this thing. If you got sleep apnea, you got to watch out, right? And so making sure you're properly getting treated for sleep apnea was the key. And so VA did a big study on this. So it's just something to be aware of. I'm not promoting CPAP machines or anything like that, but I definitely want people to be aware of these things, especially when you're like, this is in my family, what can I do? Which I hear a lot of the questions around that. So I chose this picture because I think it happens a lot, where you wake up in the middle of the night and you're staring at the clock. Though no one really has a clock that looks like that anymore, but you're staring at your phone with the clock, whatever it is, right? But what we want is this person. Look at her. Isn't she peaceful, right? Ultimately, we know that sleep is a huge base of what we do every day and will impact our day as we go throughout it. We've all had rough nights of sleep. I mean, it's part of life, I think. There's strains and stresses, and so you're going to have a bad night's sleep. And how you feel the next day is usually dependent on said sleep, right? And so that's why this is a big topic within our world of Parkinson's and certainly life in general. And so as I go through the whole next part of my talk is going to be about what do you do about it? And so try to put some of these into play, okay? Hopefully you can take a few tips from these things. How I structured it is it's looking at what you can do as a person, adjustments you can make to yourself. What can you do in the environment? Is it set up for good sleep, safe sleep? And then what can you do in your occupation of the day? So many are retired people. Occupation is really the way we structure our day, how we keep ourselves busy, because that will definitely play into how you're sleeping. Okay, the person. When we look at it, one of the big things I want to talk to people about is sharing. Many folks don't like to complain. They just say, I'm doing fine, all is good. And it's pretty classic when people go to the doctor that I'm fine. And you'll hear the person with Parkinson's say, I'm good, I might shake a little bit more, everything else is good. And their spouse is sitting slightly behind them. No, it is not, right? And they're like trying to scramble notes to the doctor. No, okay? Our nurses get calls before the doctor visit. Okay, so it doesn't help you, right? If the doctor wants to hear what's going on, and I get it, like you want to feel, hey, I got this Parkinson's thing under control, I could do this. But if you're really not sleeping well, we know it's not going to get better necessarily. And so what can we do to try to make adjustments? So let's share, learn what you can do, okay? And again, address it. Making sure that you're not just saying, oh yeah, I had another rough night's sleep, it's okay, I'll get through it, okay? And then adjusting, really taking into heart what are those things you can do. So one of the specific therapy treatments that's out there, they've done a ton of research, and I got another slide that talks about some of that stuff, is called cognitive behavioral therapy. And whether you seek out a therapist, counselor person that might walk you through some of these strategies, I'm going to talk about some practical stuff that you could just do laying awake in the middle of the night. And if you actually, that kind of helped me. So specifically how this therapy works, or why it works, is it addresses these three key areas: our feelings, our thoughts, and then what behaviors they lead to. And it's a cycle. And this is sleep, but it's also any time of the day. So for instance, let's say you wake up and you say to yourself, I'm awake again, right? I am never going to fall asleep. This is so frustrating. The feelings start to happen, right? You get nervous. Oh my God, I got a big day tomorrow. What am I doing awake again, right? And then you maybe get a little angry. This sucks, right up. Sorry for my language, that's not a word you like. But the reality is sometimes you get a little pissed off in the middle of the night if you're awake again. And then there's dread. I'm never going to fall asleep. I'm going to feel like horrible tomorrow. So all these feelings start coming along with the thoughts. And then you go to the behaviors, okay? Usually if you're in that negative cycle, the behavior is probably not that great. You're going to grab your phone, you're going to watch TV, you're going to go eat ice cream, right? And I've actually seen people where they can totally start to reward themselves for not sleeping at night. I've had folks say, hey, I don't know what we were talking about, weight loss or gain or something like that, and they were like, oh, I eat ice cream. Oh, yeah, I eat it at 2 in the morning when I can't sleep. I'm like, well, do you like ice cream? Yeah. Well, you're giving your body a reward. Hey, let's wake up, it's ice cream time, let's go. Right? So you can actually turn things completely around in the negative way if you sort of feed into it. So that's the basis of this type of therapy. Again, it works in lots of different scenarios for people with Parkinson's. So finding someone that uses those techniques in therapy or counseling can be quite helpful to sort of break the chain, if you will. This just talks a little bit more about why this is such a big need for this specific type of counseling and therapy. 98% of people with Parkinson's will report that they struggle with sleep. Again, different studies that are going on, I probably won't spend too much time on this, but knowing that this is not just something that's popped out of nowhere, that's been well researched and looked at to really help people, not only with sleep concerns, but with a lot of the anxiety, negative thinking that can come with living with Parkinson's disease. So, different cognitive strategies. So whether you seek therapy, that might be something that you need to look at, but there's also just stuff that you could try on your own. And so I wanted to go through a few of those. I use both of these 2 points often, okay? First one is distracting your mind. Most of us will wake up, and we sometimes, because it depends how I always say it depends on how you're wired. I am wired to worry. Just ask my mom, I got it from her, okay? And there's a lot of us out there. I think a lot of the ladies sometimes might be wired to worry a little bit more. There's plenty of guys that worry too. But when you wake up, if your mind is running, what did I do today? There's different ways you can try to distract yourself. So one of the examples is called mental lists. So one of the strategies that I use is I take the alphabet. We all know it quite well. And I pick one thing from each letter of the alphabet that I'm grateful for. Okay? A is always Andrew, which is my son's name. Okay? C is usually coffee. And then I go on and go forth. Usually I can come up with a couple different things at each letter. I will tell you, by the time I get to N or so, I'm out. If you can keep yourself focused on these things, it's a way to lull yourself to sleep. Simple way, you don't need technology or anything else. You could just lay there, and usually it helps to fall asleep that way. Okay? Another one is different imagery. So picturing yourself somewhere else that's peaceful. I'm going to talk about some relaxation strategies a little bit later, and so oftentimes combining breathing and imagery. I use imagery a lot when I go to the dentist office. I hope there's no dentists in here. Not a fan. Okay, and so I tell my hygienist not to talk to me because I can't stand when they talk to you and you can't really talk back, like you're, and so I say, I'm good not to chat. I'm going to picture myself somewhere else. And then I find a peaceful spot that I've been to, and I picture myself there instead of in that dental chair. So, so different things. Some people will count backwards, count forwards, count by threes, count by fives. You can pretend you're taking a cognitive test, whatever works for you. I think Series 7s is a standard cognitive test. You could push yourself to do Series 7s. Just it's something to distract your mind from that thing. Another thing that commonly works, and I have a small notebook by in my bedside table, is to write things down. So the board that put this on, I'm sure many of them were quite nervous. 300 people here. This is an amazing crowd turnout. Give yourself a pat on the back for the amount of people that showed up today to learn more about Parkinson's. But I'm sure some of the board members were a little anxious about it, right? Big event like this, you're planning it out. You're running through all those things going through your mind. I do it like when I'm planning a party at my house. Our extended families are quite large, or our immediate families, are large. We have 20 plus people in each immediate family. So if I'm ever bringing all of them together, like my son's, baptism or graduations or things like that, it's a lot. So, so I write things down. Oh, I didn't do that. If I write it down, I tell myself I did it, I put it back in my drawer. It's a great strategy for how to get that brain to shut off and think about something else, okay? Simple enough, and not a lot of technology or anything is needed. One of the key things with some of this stuff, and I'll talk about later, is to really make sure you're not waking yourself up completely and just letting it go at that point. Just to get a little bit more, again, looking at cognitive behavioral therapy strategies, a lot of it we focus on is challenging that negative worry. So these are some key questions you can ask yourself. Again, if the mind's racing, you're thinking of things, especially if you're on that path of, I'm never going to fall asleep again, and I'm so frustrated that I'm here. So what are the facts that I know for sure? Yes, I'm awake, but I know I'm going to fall asleep eventually. Most people are not awake at 2 and then never fall back asleep. Okay, most are able eventually to get back to sleep, hopefully. And so questioning the facts, and then questioning the likelihood that it'll happen again, and it may, but I can work through this. It's like boosting yourself up, kind of these mental thoughts you can sort of ask yourself, okay? And then what's the biggest thing if it doesn't happen? Well, you might need to take a nap the next day, okay? The next day might be a little rougher than you really had hoped, but still you're going to get through this. And so it's a way to kind of take those negative thoughts and sort of start to turn them around into saying, I can make this through this. And I've met a lot of people with Parkinson's, and many of you are very adaptable, so this might be something that I don't really worry about this. But for some, this is a huge issue of that negative cycle that happens, particularly at nighttime. Okay. A couple other things that I wanted to touch on are just relaxation strategies. We know that these can be helpful anytime for people with Parkinson's. Our center promotes both yoga, tai chi. We do a mindfulness program, so we're very much in tune that the way we think about things will influence symptoms and your progression with the disease course. So specifically when we look at relaxation, we think about breathing. I mentioned and there's another, I mentioned the imagery and thinking about it, kind of picturing yourself somewhere. If you can do that with the deep, deep breaths. So I personally do yoga. There's a breath where you take it in and you fully expand your stomach, and then you have to push all the air out. And my instructor's always like, make sure you get all the tippy bottom air out of the belly as you're blowing out. Okay, so that full, deep, deep breath to help with it. And again, doing that alongside some of the cognitive stuff is quite helpful. There's different things where you're tensing and relaxing muscles, some body scans. A lot of these can be learned, again, if you decide that this is problematic and you think seeking counseling and help, like from a therapist, might be useful. A lot of times they can practice these strategies with you while you're in the clinic or the center with them, and then you go home and practice them on your own. And we always encourage at our center to make sure people are practicing these even during the day and when you don't need them. So your body knows when you try this, hey, I remember doing that. I like the way I feel, so I'm going to kick in and feel calm in the midst of this. Doing these kind of strategies in the middle of a panic attack, not going to help you, right? So like you need to kind of practice ahead of time. There are some things on technology. I kind of sort of tell people to stay away from it, not worry about it because it can stress people out more. But for some, that can be quite helpful. There's some different apps out there. Calm is a quite popular one. Headspace or Insight Timer. A lot of them are about breathing and taking, they have peaceful music and things like that. Others will look at just having peaceful music. So sensory engagement is kind of peaceful music. One of the big things in studies they show is to not necessarily turn the TV on, because the TV pulls in multiple of our senses. Even though I know what you're all saying, I fall asleep in front of the TV all the time. It is different. So if you can find something sensory-wise that only picks one of your senses. So for instance, listening to the radio brings in just one sense to hearing. You're not necessarily seeing anything, right? Reading a book brings in just one sense. Following me? Like it makes sense? Versus the TV, again, your multiple senses, okay, and the light, and lots of different things. So that's why we're kind of anti-TV use, but during that awake time at night. Stimulus control, there's the definition is right there. It's basically looking at the environment around you, making sure the bed is only used for two things, right? Sleep and sex. And really focused on making that space just for that and not for just hanging out. And the reason, again, is because your body then gets used to it. I'm in my bed, I sleep here, I have sex here, maybe. But again, we're focused on sleep, so we'll stick with that. So, just controlling that environment is helpful. So some other tips here, just to lie down when you're tired is another thing. We do recommend routines, and I'm going to talk about routines later, but if you not necessarily are all pumped up from whatever reason, let's say you just got done exercising, most of us are extremely tired after exercising, though we could sleep, your serotonin and everything's pumped up, so you're not going to be able to fall asleep right away. So don't push yourself to do that. Wait till you are kind of tired. If you've been laying there, they say about 15 minutes or so awake, sometimes getting up and just moving around can actually be quite helpful. I mentioned I'm a fan of yoga. I get up and do some yoga stretches to stretch myself out a little bit. I have lots of patients with Parkinson's that do the same thing, because if things are tightening up for them, getting up and just stretching out can be really helpful. Or maybe even from the bed to, if getting up is too much. But just different things like that can be helpful, instead of just laying there kind of in agony of pain and feeling tight. And then as you work through these, paying attention, like I'm yawning, I'm getting tired, I should then head back to sleep. So now I'm going to focus on the environment. So these are some things to kind of look at. What are the factors in helping you be as healthy as you can with your environment? We are big at our center in promoting therapy and other things, strategies, not just medicine. So this is a little plug for occupational therapy. Physical therapy can as well help with kind of bed mobility and looking at adaptations, but I think OT takes on more of like things that might help you to adjust to the environment. So working on what kind of body mechanics to get in and out of the bed can be quite helpful. That's a picture of a bed rail. If it's just hard to get up and out of the bed, that can be helpful. Here's a whole list of things that you can think about that might make life easier. Sometimes changing the bed, looking at the mattress, or a twin bed can be helpful for people. I know if you're in a relationship, that's a little tricky. My in-laws had 2 twin beds for a long, long time. It worked for them. Others find that they need to be in separate rooms, and that's relatively common, maybe more common than people realize. I'll show you a picture of what a bed cradle is, but there's just different ways to kind of find so you're not caught in the sheets, which can happen. Looking at firm mattresses, There is, again, the bed cane, bed pole for how you position yourself and get up in and out of bed. Different lights in the room can be quite helpful, or regulating the temperature or even the sound in the room can be helpful. And so I have a few pictures here that kind of walk us through it. For some people, the wedge pillows and ways to prop themselves up can actually help better, help breathing better as well. So there's a thing called a short sheet that you can use. So some people, again, complain of not being able to move well in bed. They feel like they're real stiff and they can't just shift over. So you can get these satin draw sheets, or frankly, you can make them yourself. I used to say you could go to Joann Fabrics, but that's changing. But you can get like a silk satin sheet that covered on your bed from about your thigh, knee, all the way up to like your chest area. And it just you could stretch it across your bed and then tuck it underneath. Now your partner has to deal with it too, but frankly, it might help them. So then when you're sliding, it's a little slipperier fabric, so you can move a little easier in bed. Simple enough. Again, they sell them. You could buy them. But I think a lot of folks that I work with, they just make their own. And so you don't want it. Now, people will ask me, what about silk bed sheets? Then you'll have no grip. So if you're trying to use your foot to like leverage you or move around, there's nothing that's just going to slide. And so not a big fan of silk sheets. Silk pajama bottoms or tops can be helpful, again, if the moving around is the tricky spot. Pretty simple to get to. There's your foot K or footrest thing, and what it does, you stick it under your bed. Now they're just showing that your feet are there. You'd flip it over and your feet aren't there, but it's keeping the blanket away from you so you're not getting all caught up in it. Is the key there. And then that is a picture of a no-spill urinal. Again, I mentioned that a lot of people are up to go to the bathroom. I've known people that are up to go to the bathroom like 5 or 6 times in the night, which is a lot. And so if it saved you from having to get up and walk all the way down the hall to the bathroom and potentially falling or the danger of that, then sometimes people will think about bedside commodes or these no-spill urinals. And I've seen them work. We teach a class on bladder management, and we have one of these in the clinic. So the OT always pours liquid in and then like shakes it, and it's not coming out. So I think it works. Other things to think about are lights and the environment. Again, if you are doing that long walk down the hall, if it's dark and you just don't see something or you miss a step, it can be dangerous potentially. And so I actually installed these. My parents are in their 80s, and so I have installed some of these easy enough into their house. I mean, the plug-in ones are super easy, but you can buy other things. So that picture down towards the bottom, those little silver things are what those lights look like, and then there's a picture of them used along the staircase. Okay, the underneath bed one, that's on like a monitor or a stimulus in which the person would step out of bed and the light would come on. And so just different ways. I get it if you're the partner in the bed, you don't want the whole light coming on. So sometimes these more subtle lights can be quite helpful. Okay, last topic I want to just touch on is routines and looking at things. How active are you during the day and how predictable are you with these things? Trying to get up at the same time every day, go to bed at the same time, starting to develop these routines. We know that folks will want to think about napping because fatigue is quite common in Parkinson's, and I have some stuff on that too, as well as anxiety. So sleep hygiene, again, a term that's often used to describe what are the behaviors around your sleeping. So these are kind of things like looking at what's the environment like. I like this term of you find your Goldilocks environment. Right? It's not too hot, not too cold, not too light, not too dark. Everyone will have something that helps them be more comfortable at bed. Key thing, going to bed that when you're full, like don't go to bed hungry. Then that 2 o'clock ice cream bowl will actually, because you're hungry, so making sure you have something to go to bed. Some people will take food with their pills, to make sure their stomach has something in it if they took a bedtime dose of pills. And then this idea of exercise, don't do it right before you go to bed because it activates you more. So it's about 3 hours is kind of what research tells us. Looking and limiting naps, that's another key one. A lot of people will find that they nap a fair amount during the day. And as much as I can appreciate that your body is tired, especially if you've been active or worn down, Parkinson's can take its toll on you. Napping is something we want to watch how long you're doing it and how often. So the general gist of a nap, 30 to 45 minutes is kind of the limit. Beyond that, you're going to get to the deep, deep sleep, and then when you wake up, you won't feel refreshed. Instead, you'll actually feel more tired. And I'm sure you've experienced this. If you ever kind of let yourself nap and it goes a little long, you wake up kind of groggy. And it's not a great feeling and great spot. So if you can limit when you nap, or how much time you nap, and even where you nap, not sometimes just a nap in the recliner is almost better than the bed. Okay. So just to highlight, fatigue is part of the journey for some people with Parkinson's. We recommend that you keep track of the fatigue. It can be linked to medication cycles. So sometimes if meds are spread way too far apart and you're hitting that fatigue and that off state, that can make a difference. And so if fatigue is part of your issue, we also want to look at what kind of activities you're doing around that. It seems counterintuitive, but exercise and staying active are actually helpful for dealing with fatigue. And so napping and just not being active make fatigue worse, which is what you want to do usually if you're fatigued. So it doesn't always make sense to people, but it's the truth, and kind of lots of data around that. But recognizing you may need to budget your energy. So listening to your body can be very helpful. Like I said, we're not opposed to naps and things like that. But recognizing instead that resting and being peaceful, reading a book, doing something that just calms you is another way to not necessarily nap, but just allow yourself to kind of be in the moment and just relax is probably the better route to go than take that full-blown nap if you can prevent yourself. This is a lot about how others can help you as well, making sure that if fatigue again is an issue, energy is an issue, that you're asking folks for help and getting support when you need it. And then there's some things about napping. Again, timing of napping is important too. Okay, mentioned exercise, and you can't get too far in a Parkinson's conference where you don't hear about exercise, right? So looking at ways to exercise regularly, and then finding a variety in how you exercise. If you ask one of our PTs, we have 6 of them at our center, if you asked them what kind of exercise is ideal for Parkinson's, most of them will just tell you something that you will do, right? If you box, you box. If you dance, you bike, whatever it might be, but you find something that you'll do, and that's probably your best exercise. Ultimately, the goal is about 2.5 hours per week of exercise. And so finding ways to space that out. You probably don't want to do 2.5 hours one day. So, finding ways to kind of do it in smaller chunks. Term our PTs like to use called snacking on exercise. So instead of I have to go for this, 1 hour walk, maybe you do a couple 15-minute walks as a way to kind of pace out what you're doing. And then kind of looking at varying what you're doing. Based on a 13-year study, the Parkinson's Foundation came up with this standard, and I hope that you've seen this before. It's a readily available handout that they have, looking at how to vary the type of exercise that you do. So certain number of days of aerobic exercise, but remembering strength is just as important as is balance and stretching. And so if you're not doing a variety of this, they really would like you to kind of shift into one, because some people, I just walk. Well, have you done any strengthening? Having strong arms and legs can be quite helpful in function, particularly as the disease progresses. So staying strong is quite helpful. Okay? Again, this handout is fairly readily available from the foundation. I know you can download it. Okay, a couple other things then that we know that are part of Parkinson's is a term we call apathy. It's basically just lack of motivation. So sometimes that can be part of struggling with a routine where you are just not real motivated to do anything. And so you just kind of want to sit. And so if this is an issue, you got to find a way to challenge it. And there's different strategies for how one might do that. A lot of it will involve what I call external motivation. So your internal drive is not there anymore. It's harder to get engaged. So what are some external things that can help you? And so it may be that that's family. It may be that that is or friends, family and friends, or a fellow person with Parkinson's that is going to pick you up to go to the exercise class and you go together. You know, different ways of feeling like you can be empowered to still get things done. So specifically, we look at what's your daily schedule. And this one I talk a lot with patients is 3 things every day. 1, physical activity. 2, something social to connect you with other people, okay? And then 3, something that helps bring you joy and helps you feel good about yourself. So maybe it's volunteering, maybe it's chatting with your adult daughter on the phone, maybe it's meeting a friend for a cup of coffee, reading a good book, journaling. I mean, it doesn't have to always be with, with someone else, but finding little things or big things that bring you joy. So those 3 things every day will help you to get your routine on, help you deal with your mood changes that might be very present and very real, and ultimately will help you get to sleep a little bit better because it will get you a little bit more active. This just talks about the different ways to deal with apathy, like setting goals for yourself and kind of helping and some rewards to make sure you're keeping as active as you need to be. And again, with that goal of the more active you are, the better your sleep will be. Some other things that we know, different studies will look at natural light being very helpful. So getting outside. We're pretty blessed. I'm from Minnesota, but we're pretty blessed. South Dakota, beautiful state. You got a lot of great things out here. So taking advantage of getting outside. And most of us are pretty hardy, so even in the winter, we usually find ways to get out, at least enjoy a little bit of sunshine. What's that saying? It's all about the clothing you wear. It's not about the weather or something. Regular meal times. There's a couple different studies looking at the idea of having those regular meals. This is a picture of social. A lot of us socialize around food, which I know certainly can have some challenges with Parkinson's and medicines and stuff like that. But finding ways of connecting with other people and helping with that regular meals is thought to be very helpful. Okay, so just my summary. It's certainly important to understand concerns and symptoms that impact your sleep. So again, if you have these concerns, involve your people, talk with your doctor. Make sure they're fully aware of, hey, about 2 or 3 times a week, I'm just not sleeping well, and I'm thrashing or I'm just awake. Is there anything that can be done? Okay, my bladder is a huge issue. Is anything that can be done there? So involving the doctor, looking. Are there the rehab team? So PT, OT, what can they do to help you stay as active as you can, but also make adjustments in your home? Mental health providers, looking at folks that can walk you through counseling and knowing how do you squelch some of those anxiety thoughts that might be happening. And then the environment and just what I do during the day. Can those be adjusted? Is there any small changes that can be made? And then I'm a big quote person, so it's not selfish to love yourself. So take care of yourself to make your happiness a priority because it's just necessary. Okay, so thank you for having me. Glad you're all here today. I am done. Are we doing questions? Is that why you guys are standing at mics? Okay, I will take a few. If there's any questions, I'm certainly open to them.
How do you turn it on?
Hello?
I think you got it on.
Any questions?
Is there a connection between Parkinson's and now I forgot what I was going to say. And I'm not,
So Parkinson's and some sort of other health condition, or?
Sleep apnea?
Was it sleep apnea? Yeah, it could be.
yeah, no.
We can come back to you.
Okay.
Anyone else?
What was that? On the slide, what was that about?
But she wants to know the scan about the slide about body scanning.
So body scanning is a technique you can do to kind of bring awareness to how you're feeling. And so different strategies around body scans, but it's kind of one you can do where you're sort of picturing peace go over, like I feel peaceful in my head, I feel peaceful, relaxation in my cheeks. There's different body scans that way. And so it's more of a mental strategy versus like a scan, like a machine scan, so it's confusing, but just different, an approach to how you might kind of feel relaxation within your body. Probably something that you would want to, you'd meet with a therapist, a counselor who would train you in a technique like that. But it also use, like my yoga instructor uses it at the end of our classes, you know, so it's used that way as well.
Thank you.
Thank you. We have a question over here.
Yep. Oh.
You mentioned breathing. Breathing can help sleep apnea. What tools or techniques can you recommend to increase lung capacity?
Oh. So now we're getting it. I should have mentioned our speech pathology colleagues, because they actually work with lung capacity and different strategies. I was getting at breathing as more of a de-stress type activity, a little less on the lung capacity, but I think certainly if people are having issues there, or again, maybe sleep apnea, but certainly more along the lines of stiffness and problems with their diaphragm, which can happen in Parkinson's disease. Our speech pathologists teach people all the time about lung capacity. I have the privilege of working with music therapy. She also talks a lot about lung capacity and deep breathing. Not sure if I think there's resources here in the South Dakota area of different choirs and use of music and all the training that goes in for vocalists too. I don't know if that completely answered your question, but okay.
We have one here.
You didn't talk much about blue light and how that can affect sleep.
Yeah, they're still doing studies on light around. So certainly blue light is something that comes off from our phones, and it's like and the TVs and other technology. So that's why staying away from that stuff. So, you know, I have teenagers, so they actually wear blue light glasses all day because they're on their computers for that's how we do school these days. So yes, limiting screen time is a big deal to help with sleep. I thought you were going to get at light therapy. Light therapy is another treatment that can be used to help with sleep, but studies are a little short on that. But yes, so limiting screen time is that idea of limiting the blue light. Good point.
Okay, we have a question here.
I found that white noise helps me to fall asleep quicker at night.
Yep. What kind of white noise do you like? I don't see who's talking to me, but.
Floor fan.
Okay, yes. Fans, sound machines, all sorts of stuff that can help make that noise. I have teenagers, and we used white noise in their room when they were babies, and they still use it. Like, I think it's a comforting thing for them. It's making that Goldilocks, like what's ideal for you space. So certainly noise is one of those. Mm-hmm.
Has there been any recent studies done with medical marijuana?
No, not that I have not seen studies per se, but obviously it's available more and more. It's legalized in Minnesota. We sell all sorts of different products that have it. So our big thing is not necessarily medical marijuana, it's just the use in general. The line that our docs will often use with people is, you just need to know how it will influence you. It's kind of like we tell people with alcohol. Some people will say, well, if I have a glass of wine, I sleep better at night. Not necessarily, because the sugar's in wine particularly, but we know that some people will just be more impaired because of the use of marijuana, THC, that kind of thing. Some people will think that it helps them with their anxiety, and it might, but again, looking at, it's not something, it's tricky to control. That's part of it is, the manufacturers, they manufacture these different products. You don't know how much, what's real and what's filler. So there's still some limit on that. Our general theory at our center with our docs and the rest of us is that, again, figure out what if it helps you, but know that the negative effects can come with it too. And particularly marijuana is a depressant. And so it slows you down more. And I'm sorry, most people with Parkinson's are already kind of slowed. And we worry about balance and we worry about further impairment. And so it tends not to be like a go-to, and none of our docs can legalize medical marijuana. Like, it's just not something that we tend to promote too much.
Okay, the question was about.
She's too embarrassed now.
Yes.
There's like 300 people in this room. Don't worry about it. I get it. Okay.
Parkinson's, sleep issues, and narcolepsy.
Oh, I did not see a lot about narcolepsy. Not saying it probably doesn't happen. Again, maybe it's just extreme insomnia, they might call it, but I have not specifically seen a lot on narcolepsy. We would probably just say it's like fatigue from Parkinson's. I mean, there'd be like ways to work around it.
We have one last question.
A lot of people do
One
that.
more. One more.
One more question.
One more right here.
This is extremely helpful.
Good.
Are your slides on your website, or how do we get a hold of them?
That is a great technical question for the lovely board members. They are, you can have them. I have no.
Yeah, we'll work on putting those on the website.
Perfect.
And making those available to everybody.
Perfect, thank you.
Thank you.
Great audience, thank you. I didn't see any nodding off, so good job. Be proud of yourselves.